A Barcelona hospital is trying to keep spirits high as a second wave of COVID-19 hits Spain. They're giving long-term ICU patients a break from the constant buzzing of machines, bringing them to the beach for some ocean breezes instead.
In Spain, the number of people who have died with the coronavirus has risen again.
The first wave was very horrifying.
Spain, France and Belgium have all strengthened local health rules and in some cases imposed localised lockdowns amid fears of a second wave of the virus.
In August, it started the second wave. Patients rushed to the hospital with worries in this second wave more than in the first wave. They know what could happen when they have to be admitted in the ICU. This program includes different activities that are directed to improve the mental well-being and the mood of critical patients. Our ICU is in the ground floor in the hospital. This specific activity consists in to bring the patients to the Barcelona seafront. This is a therapeutic activities. Patients, they have to face a very difficult situations in the ICU. We in the Hospital del Mar, we have the privilege to be very, very close to the Barcelona seafront. We just have to cross a street and we are in the seafront, so the hospital is in the beach. We stay in the seafront around 15, 20 minutes. Our mission and our role is to taking care about this mental or psychological well-being.
And what's the emotional reaction like when you go down to the beach with the patient and you see them smile and you see them happy with their family? What does that feel like for you?
Yeah, it's the best moment. Sometimes they can express that emotion. Sometimes it's more difficult, but it's obvious that the result is positive. The image of a patient crossing the street here in Barcelona is powerful, but the most powerful thing is it's all the work that there is behind this image and all the positive results that we obtain with that program.
The coronavirus pandemic has been exposing all kinds of inequalities in the American healthcare system. Just this week, a report from the CDC said COVID-19 kills more Hispanic and Black kids than white kids. This data echoing racial disparities among adults in the pandemic. In New York, the Latino community was hit the hardest by COVID-19. And NBC News spoke to the chair of the emergency medicine at Mount Sinai Beth Israel Hospital about fighting the virus.
My name is Yvette Calderon, and I'm the chair of emergency medicine at Mount Sinai Beth Israel. It was in warp speed. We had done a tremendous amount of work within the hospital setting, but now we had to, just throw ourselves into how do we create an emergency department that's safer for the patients and for our staff? Do we have enough PPE? What are the things, the science was emerging so quickly. 1 minute it was this, the next minute it was that, what treatments were good or not. So we had to keep on top of that as well. Crisis is what we do in emergency medicine. That's what we're good at. But really in spurts, right? You give us a crisis for 12 hours or 24 hours, we deal with it, and then we go on. When you start talking about a crisis that deals for weeks, months, that's a very different, to me, it's akin to, some kind of military setup, right? Where you're constantly being bombarded. We work well when we can be with a family and help them through a journey where their loved one is dying. We can do that. It's very different when you have a person who's at their end of life and you can't have their family around them supporting them. I feel like coronavirus took that away from me. I know this firsthand because my father passed away April 6th. He was in the nursing home, and of course, coronavirus hits, and and I can't go in. I remember distinctly speaking to their provider and saying, I want them tested for COVID. You know, my father's drastic change in his mental status was what I was seeing in the ED. So I knew he had it, and then my mother ended up having it as well. She survived, but he didn't. And I think the most painful part of that was not being able to be there for him. You know, here I am with other people in the emergency department, but I can't be there for my own dad. That was hard. I grew up in the projects, in the Chelsea projects. And so when you're growing up with family that are from Puerto Rico, who have their own issues with literacy and their own journey was difficult, the children tend to be their navigators and their translators. And so, you know, I saw fairly early on between what was around me and the environment and also just personal experiences with my family, with the health system, that, you know, there was a real gap for Latinos within the healthcare arena. In retrospect, now that we know the vulnerable communities, who is more at risk of getting coronavirus, my hope is that those are the communities that we test first. My hope is that those are the communities that we go in and give the vaccine when the vaccine is ready to be given first.
I'm going to give you a better mask.
Coronavirus has really highlighted all of the social determinants of health, right? The food desert that exists for some, the homelessness, you know, the housing situation that existed for so many and still does. Coronavirus not only highlights this, but also gives us the answer of where to attack first. It's not tolerable not doing anything. You know, we've known for a long time health disparities exist. Why haven't we been able to make some dent in it? And so it's incredibly important for patients to see providers that understand them and can relate to them. I can't tell you many times Latino patients will say to me, you know, I'm so happy that you're my doctor. I'm so happy that you understand what I'm telling you. My father and mom, they didn't have a lot, but they would give whatever they had to anyone else in need. So growing up like that, I think, has really set the path for me to be in healthcare, to give what I can give to the people that need more than than myself. And so, you know, that's why being a Latina is just threaded through every part of who I am and what I do.
COVID-19 cases are rising in 19 states, and few cases have been ticking up all week. It's been 6 months since the U.S. declared a national emergency, and we've lost nearly 200,000 lives to the virus. So what can we do to finally turn the corner on this pandemic? Dr. Aymesh Adalja joins me now. Dr. Adalja is a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, cases across the country were declining. Now they are rising again. 42,000 new cases were reported in the last 24 hours. What's going on?
We're going to see this ebb and flow because many parts of the country don't have the virus under control. We know people are socially interacting. We know university campuses are opening. Sports are starting to go back into action, as well as schools opening. So we're going to see some level of cases that are always going to be a challenge to control. We're never going to get this Taiwan level control. So I do think that what we'll see is public health interventions tied to when cases start to rise and when hospitals start to feel some pressure. But I think this is going to be the new normal, that we don't get some level of suppression that other countries have achieved.
Thanks. And Dr. Adalja, we're heading into the flu season. The CDC is warning today about a possible twin-demic, the flu and COVID-19 at the same time. Are you worried about that?
We have to be prepared for it. We know that flu circulates around this time. It starts to circulate, and it can be very severe. We are hearing good news from the southern hemisphere, however, where flu cases are down dramatically, because we know that a lot of the social distancing that works for coronavirus will also work for influenza. So hopefully we won't get hit hard, but it is very important that people get their flu vaccines, because we want to make sure that we don't give the flu virus any chance to establish itself this season, so we have room to take care of COVID patients in our hospitals.
And when it comes to timing, when is the best time to get a flu shot?
In general, I usually recommend people to get it in October because we don't want them to get it too early and it wear off. However, if you can only get the flu vaccine now in September, or maybe you miss the October time and can get it in November or December, it's still important to get it. So I want everybody to get a flu vaccine. Ideally, I like October, but whenever you can get it is good.
And Dr., New York City's Mayor Bill de Blasio announced this morning in-person schooling will be delayed again. New York's infection rate is relatively low at this point. Do you think that delaying was the right call?
It's very difficult because there's many different moving parts there. And I know that there are a lot of concerns about teachers and principals and about getting the schools in shape to be able to do social distancing. But I do think in a place like New York City, where this virus has largely been controlled, where the percent positivity is very low, I do think that in-person schooling is something that is extremely feasible compared to other parts of the country that are doing it. They're going to be opening indoor dining in New York City soon. If they can do indoor dining, they can do in-person schools.
And Dr. Adalja, there's a new study out that suggests that wearing glasses might protect you from the virus. What do we know about that?
This is an observational study from China, and it's not definitive, but it does suggest that people using some sort of eye protection, even something as minimal as eyeglasses, can prevent you from getting infected. We know that you can get infected through the mucous membranes in your eye, and anything that prevents you from touching your eye, whether that's a face shield, whether that's goggles, or whether that's simple eyeglasses, may have a role. So I think this is important, and I think it's further evidence that eye protection is really important when it comes to protecting yourself from getting infected, and that's one of the reasons why I'm a big fan of face shields.
Got it. Thanks so much. Good to know for all of us glasses wearers. I mean, masks and glasses don't really go very well together. So yet another reason to just get through the foggy glasses. Thanks so much, Dr. Adalja.
Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.